Good morning. My name is Mike. I'm going to be your student nurse today. I'm here to do your physical head-to-toe assessment. Before we begin, let me wash my hands. All right, can you verify some information for me? Can you tell me your name and date of birth? Okay, perfect. I'm going to start by inspecting your head. I'm going to palpate your scalp. I'm checking for any depressions, infestations, lesions, which I find none. Next, I'm going to palpate your sinuses. I'm going to start with your frontal and move to your maxillary. Just tell me of any pain up here. That's your frontal, maxillary. Okay, perfect. Now I'm going to inspect your ears. I'm going to palpate your auricles. Tell me of any pain in the tragus. Okay. Now I'm going to check for any discharge or blockage of serum, which I see none. Now I'm going to inspect your eyes. They are bilaterally symmetric, and I'm going to inspect or check your pupils. Good. Now, do you look at the tip of my pen? The little arm in the back to my pen. Good. Your pupils are equally round, reacted to light, and they accommodate evenly. Now I'm going to check your nose. If you'll tilt your head back a little bit for me. Mucous membranes are pink and moist. I see no deviated septum. Go ahead and flare your nostrils for me. They flare symmetrically, and now I'm going to check for pain. See, sniff through one side, now the other. Good, I hear no blockage. Now I'm going to check your mouth. Your lips are pink and moist with no cracks. If you'll open your mouth for me. Mucous membranes are pink and moist. Tonsils intact. Tongue pink and moist. Hard palate pink and moist, free from any lesions or sores. Will you lift your tongue? Soft palate pink and moist, free from any lesions or sores. Teeth are white and lined, and gums are pink and moist. Good, you can close them. Now I'm going to inspect your neck. I'm looking at your trachea, which is midline with your body. I'm looking at your thyroid, which I see no lumps or abnormalities. Palpating to see if I feel any lumps or abnormalities, which I don't. And now I'm going to check your carotid artery. I'm going to listen for any bruise, which could indicate blockage or narrowing of the vessel. I'm going to use the bell on one side at a time. All right, I hear no bruise. And I'm going to palpate both sides, doing one side at a time. All right, good. And now I'm going to look at your anterior thorax. I am going to inspect your skin. I'm checking for temperature, which you're warm and normal. Moisture, which I feel none. I'm looking for any edema or lesions, which I also see none, no indication. I'm going to have you take a deep breath for me. And out. Your lungs rise and fall symmetrically. And now I'm going to listen to your lung fields. Okay, good. Your lungs sound clear, free from any rhonchi or wheezing. And now I'm going to check your cardiac, which is your heart, and it's located between the second and fifth intercostal space. I'm going to feel your skin. I checking for any thrills or heaves. I see no visual pulsations. And I'm going to start by listening to your heart valves, starting with your aortic valve located in your second intercostal space, just right of the sternum. And your pulmonic, which is your second intercostal space, just left of the sternum. Third intercostal space is your Erb's point. Fourth intercostal space is your tricuspid. And your fifth intercostal space is your mitral valve, also your PMI, point of maximal impulse, also where your apical pulse is located, which I'm going to listen to. Good, sounds clear. Free from any dysrhythmia or murmurs. Sorry. Now I'm going to check your anterior thorax, or posterior thorax, sorry. I'm checking for any scoliosis, kyphosis, or lordosis, which I find no indication. Go ahead and take a deep breath in for me, and out. Good, your lungs rise and fall symmetrically. I'm going to listen to your lung field, or auscultate your lung fields now. also gonna check your right lateral side for your third lobe. Good. Your lungs sound clear, free from any bronchi or wheezing. Now I'm going to check your upper extremities. I'm gonna start by inspecting your skin. I see no lesions or edema. I'm checking your skin for temperature, and moisture, which is normal, and I'm also checking your skin for turgor, and I see no tinting. Now I'm going to check your fingernails for any clubbing, and also your capillary refill, which they blanch within 3 seconds, which is good. Good. And now I'm going to check your pulse. This is your brachial pulse and your radial pulse, which are both bilaterally symmetric. Now I'm going to check range of motion and strength in both arms. If you want to just rest them to the side and then raise them up, that's abduction. Flex them, that's flexion, extension, and then adduction. Good. Now put your hands flat like this and then push up on mine. Good. Now push down. Good. All right, now if I could have you lay down. All right, now I'm going to inspect your abdomen area. I am inspecting. Take a deep breath for me. I'm just checking to make sure your stomach is smooth, free from any growths or abnormalities. Go ahead and get your hair out, I'm sorry. I'm going to auscultate your abdomen, all 4 quads. I'm going to start with your right upper quad, right lower quad, left upper quad, left lower quad. Good. I heard audible sounds in all 4 quads. I could have heard hypoactive, hyperactive, audible, or absent noises. If they had been absent, I'd have waited up to 5 minutes in all quads till I heard a noise. Now I'm going to palpate your quads. Tell me of any pain or tenderness while I'm feeling for any bumps, growths, or masses in there. Your left upper quad, left lower, right lower, right upper. Good. Now I'm going to move to your lower extremities. I am checking your skin for temperature, color consistency with the rest of your body. I see no signs of edema or lesions. I am going to check your capillary refill, which they blanch within 3 seconds, which is good. I am checking your posterior tibial pulse and your dorsalis pedis pulse, which are both bilaterally symmetric. And now I'm going to check for strength and range of motion. I'm going to bend your leg up. That is flexion, extension, abduction, adduction. Good. Now if you'll press up on my hands for me. Good. Now if you'll press down. Good. And I would do that to both legs. Here, let me help you out now. And do you do a monthly breast exam? Well, you should. Even guys should do it. You should do it at the same time every month to check for consistency. I know you're not a guy, but I just said that just because I'm a guy and I do. Follow my motions, hand behind your head. You're going to start in your axillary and you're going to move in a counterclockwise motion, gently palpating around the breast until you get to the nipple, and then you're going to squeeze gently. You're checking for any discharge. If you find any discharge or growths or pain, you're going to want to contact your primary care physician to schedule a more thorough examination. Do you have any questions? Okay, good. We're done for the day. You can get your shoes on, and the doctor will be with you shortly.